Let's talk about diagnosis. Give me an idea of what's going on. Why did I say idea?
Yes, I'm glad that you brought up idea or ideas. I'm the PI or the principal investigator locally for the IDEAS study, which is looking at imaging in dementia and screening for amyloid, or the protein that we find on autopsy in Alzheimer's disease.
So imaging would be x-raying or viewing some way, and the amyloid is what?
Amyloid is the protein. Amyloid beta is a protein that we find on autopsy in Alzheimer's. We think it's the first protein to start to accumulate or clump up in the brain, causing damage to the brain cells.
So how early can that occur?
We think that amyloid accumulation occurs in our 40s and 50s and actually reaches peak by the time someone's having minimal symptoms. So waiting until your brain is maxed out with amyloid is not a great thing.
So if it starts at age 40 or 50, I might even have it, huh?
Maybe. I probably do too.
So if we have it, does that mean we have Alzheimer's? Do we know that amyloid definitely means Alzheimer's disease?
Well, there are some conditions where you can find amyloid deposition, and we all have a little bit of amyloid. In this particular case, in Alzheimer's, it's not just a little bit here and there, it spreads throughout the brain. And so what we're trying to do is, waiting until autopsy is not a great option. So there's a special imaging technique called amyloid PET.
So it's a special PET scan.
Yes.
So in positive emission
tomography, yes.
Tomography. And so it's special. Is it, what does it show? Just amyloid?
So what it does is that there is a tracer that tags onto the amyloid temporarily, and an individual will take the tracer via an IV and then go have the pictures taken with the CAT scan machine, and we'll see where it lights up.
When it lights up, what does that mean?
When the whole brain lights up, that is a positive scan. A small amount of amyloid deep in the brain is within normal limits. That's considered normal.